Assalamu alaikum and welcome to Parenting Hour. You're tuned into Unity FM 93.5 here in the West Midlands and 105.1 for our Luton and Milton Keynes listeners that are tuned in on Inspire FM this evening. Welcome to this evening's show. We have a wonderful set lineup of guests here for you this evening, mashallah, trying to get across very important messages. And it may be not for you, it could be for your sibling, it could be for your auntie, it could be for your uncle, it could be for your mom, for your dad, for your neighbor. But it's important to spread this message, to get across this message to others and not just keep it for yourself, and get it across in different languages to everybody, inshallah, as we're going to be talking about neonatal service and the wonderful service we have here in Birmingham. And I'd like to introduce my guests who are going to tell us all about that wonderful service. So we're going to start first. I don't know where to start first. Will I start with the ladies first? Sorry, David. So here we have Dr. Henna and we have Claire with us from the neonatal services. Good afternoon to you. How are you?
Yeah, we're well, thank you. Thanks for the introduction.
We're good, thank you.
Good. And Davy, good afternoon to you.
Hi there, Kathleen. How are you doing?
And you. I'm saying good afternoon because, of course, this is going out in an afternoon show, even though it is a pre-recording. So, listeners, if you do want to phone in to find out any information, it is not a live show, but it doesn't stop you from phoning in. Please leave your questions with the studio managers and we will pass on to these wonderful guests and get the correct answers for you for those questions or any comments that you may have, or email addresses and phone numbers that they're going to give us also. We will leave all this with the studio manager. So where can we start about this neonatal service? Who's going to first start and tell me a little bit about yourself and about your role? Is that you, Claire?
Yes. I'm Claire Raymond. I am a neonatal nurse by background. I now work for the West Midlands Neonatal Network, which links all hospitals in the West Midlands who provide care to sick and premature babies. So our role evolved from the Neonatal Critical Care Review, which highlighted that as a nation, we needed to improve the experience and support for families within neonatal care. So we're really interested now to hear from parents and families who have had a baby on the neonatal unit of what their experience was like.
Wonderful indeed. And of course, the neonatal unit has been going for many years and you have had lots and lots of families using your unit. Why is it important now, you think, to get this message across?
Because we are really trying to improve the services for families, and it's really important that we have representation from local communities so we know what they've experienced, how they've experienced care, and what has worked well for them and what could work differently, and how we can improve things. And we really want to hear from them so that they can be part of the work that we're doing across the West Midlands.
That sounds like a wonderful piece of reflection work that's going on at the moment. And I'm sure this has been going on for many years. Indeed, it's important for all of us to see what we all can do better in our own lives, as well as in services. Henna, tell us a little bit about yourself and about your role.
Assalamu alaikum. I'm Dr. Henna Sayed-Sabra. I'm a clinical psychologist and I work at Birmingham Children's Hospital. So I work in the intensive care unit. So slightly different role to Claire and Davy. So I work with families and staff who look after very sick children and babies in the intensive care unit in Birmingham Children's. And part of my role also is, part of my experience of being a psychologist, also being a parent. And part of that is having been a parent on an intensive care unit as well. So I guess today my message really is to parents out there who have had babies who've been in neonatal intensive care or in neonatal services to come forward and tell us about what your experience was like. It's not always good stories, unfortunately. Sometimes we have some really difficult stories to share, and we want to hear some of those stories. So I'm here as a parent as well as a psychologist to tell you about my own story a little bit, but also just to encourage families to come forward. Thanks, Kathleen.
Wonderful. We're going to come back to your own story in a little bit, which will, I'm sure, inspire others to come forward. Davy, can you tell us a little bit about yourself and your role?
Yeah, sure. Thanks, Kathleen. So my name is Davy Evans and I work as a clinical psychologist in the West Midlands Neonatal Network. And yeah, I guess I'll just echo what Claire said, really, about the importance of designing and delivering services alongside the people who use them, and there are a lot of people who use neonatal services in the West Midlands, and not just Birmingham, as far north as Stoke, as far south and west as Hereford, and into Coventry and Warwickshire as well. And I guess you asked kind of why are we talking about this now. I think it's really important to acknowledge in recent months, this year, we've seen the publication of two really challenging reports, the East Kent report by Bill Kirkup and the Shrewsbury and Telford report by Donna Rockenden, that have highlighted some of the challenges experienced by families in maternity and neonatal services. And I think it just really underlines the importance of improving. There's incredible quality care that's happening across the West Midlands, but there's always things that we can do to improve that. And from my perspective, it's so important that we do that with the families who are going to be using these services, because those are the people who know what they need, and we can speculate about what they need, but actually what we need to do is listen and respond to, and then work with families to improve our services.
Mm-hmm. Great. I admire the way you're improving, and we've done a lot of shows recently about maternity service improving, and you mentioned some of the reports. We've referred to them before, along with some of the other reports that have recently come out about the invisible Muslim women, indeed, and around maternity in particular. And it's working together, isn't it, to really improve our services, improve outcomes for our parents. And for me, I feel very, very sad when I hear of either a loss of a baby or a mum. But I know you work really hard within the neonatal services. Maybe some of our listeners don't actually know a lot about the neonatal services. So can you just explain to us what is neonatal and what does it do? What do you do in that unit is kind of tucked away? Yeah.
The neonatal unit looks after babies who are born prematurely or very early, or babies who are term babies who are sick and unwell. It is an intensive care unit, and we really want families to be present and part of the care of those babies. They could be very, very sick, or they could just be unwell and have a short stay with us. There's a huge variety of the different babies that we see on the unit.
And where's that unit based, Claire?
Most of the hospitals in the West Midlands would have a neonatal unit. As Davey said, we have units, there's 14 across the West Midlands, and they are part of the maternity services.
And are they in each one of those hospitals? Is that
yes?
You find those units. So brilliant. So, and when we're talking about, you said now it's for sick babies and that. Can you tell us a little bit more about what are the babies that use the service? Why did they use the service?
Well, a premature baby would need to come to the service. They would need help with breathing mostly.
So you were just saying there where babies may need life support. Maybe, David, you can tell us a little bit about the different babies that come in, the ranges of
sure.
Surface. Yeah.
So like Claire said, there are 14 neonatal units around the West Midlands, and some of those are intensive care units who care for the kind of the smallest and the sickest babies. Some of those are what we call local neonatal units, and some of them are special care baby units. And really what we aim for is babies to be cared for as close to home as possible, and in the unit that provides the most kind of appropriate level of care. So some of those babies may have been born a couple of weeks early, may need some kind of additional support with feeding, growing until they're ready and safe to come home. Some of those babies might have more kind of intensive care needs, so they may require more kind of help with breathing, more kind of medical intervention. Some of those babies, some of these families who use neonatal services know that they're going to, or likely going to need neonatal care before the baby is born, potentially from quite an early stage in the pregnancy. For some families, it's quite a surprise and it's really unexpected. Some babies are in neonatal care due to kind of medical conditions that they are born with. Some of them are in neonatal care because of kind of illness or medical needs that they develop in the period immediately after birth. So it's really variable, actually. And I think although certainly in the work that I do clinically as a psychologist, the families that I meet, there are certainly a lot of common experiences for families in neonatal care. Every family has their own different journey and their own different experiences, and babies have lots of different kind of journeys through neonatal care. I think that's probably fair to say.
Yeah, it sounds like this, and it sounds like, some parents are probably totally in shock because they've never come across this before, but other parents have had time to realize that and come to terms with their baby may spend some time in neonatal care. Maybe this is time to come to Henna to talk to us a little bit about your story, Henna, of, if you don't mind sharing with us, of what happened to you, so that parents who have never experienced this can kind of understand what it is like.
Yeah, so my story is a little bit different. That my baby was born without me knowing that I had any problems in pregnancy. So I didn't have that experience of knowing that I had a baby with a condition. And I guess the other bit of the story that's slightly different is that my baby wasn't born premature, which is a lot of babies who are in neonatal care. So he was on the neonatal intensive care unit for a short period of time, and then he was transferred to the pediatric intensive care unit, which happens as well to our children, our babies. I think sometimes people assume that your baby will be in one place, and sometimes they're transferred between hospitals, which is another thing that's quite hard for parents to contend with, because all hospitals have different rules and different things you're allowed, especially since COVID. So sometimes parents are allowed to be together with their baby. Most of the hospitals allow that. Sometimes it's one parent at a time, particularly in pediatric intensive care unit. So all of these rules have changed more recently, which has added in some more things. But at the time when I was there, I wasn't allowed to travel with my baby, which is now changed. So now when your baby is 6, some of the ambulances will let you go with your baby. Sometimes they don't. That was really shocking for me, because we've never heard of babies being separated from their parents. Most assumptions is when you become a mum or a dad, you stay with your baby. You don't expect them to be separated from you. And that's quite hard at the very start. The other bit that's quite shocking as a parent, you expect to be able to feed your baby, whichever choice of feeding you want to be able to do, whether that's bottle feeding or breastfeeding. And suddenly all these choices are taken away from you. You've been told, no, you can't do this, and you can't feed your baby, and they've got to be fed differently too. So that was something that was quite hard, alongside the massive thing, which is the diagnosis that you find out of what's wrong with your baby. So being told something, and I'm a person who was a psychologist for many years before I had my baby, before I had my son. And so I had lots of experiences of being in healthcare, and I found it incredibly hard to navigate and understand what was going on. And so I often think about our parents who haven't been in hospital ever before, who haven't necessarily got medical language in their kind of toolbox. And then they're told all this complex terminology about their babies, and they have to come to terms with it very quickly, because decisions often happen around them. And what we want is to change that. We don't want decisions to happen around them. We want to make it happen with them. We're working with parents alongside our medical teams and healthcare teams. So for me, it felt like all the decisions were made around me. I sort of was very quickly moved. And the other bit is that you've just had a baby, so your body isn't recovering in the way that you would like it to be. So you're suddenly expected to be up and about. And we see lots of parents who have, deliveries, normal deliveries, or kind of C-sections or complex deliveries, having to suddenly be mobile and walk around, to different parts of the hospital to look after their babies. So all of these stories want to hear about. And so for me, I had to make that journey across to a different hospital, having just given birth. And then often be in a bed space with a baby where there wasn't appropriate places for me to sit. So I know a lot of neonatal units are working to change this, but this is another thing as a parent we experience sometimes, that you're sat on a very uncomfortable seat having given birth next to your baby, not knowing what's going to happen, and suddenly these medical teams appear with lots of things and lots of conversations around you without really using your name. So they often say, oh, mum is sitting there, and sort of you're like, I can hear you, I'm right here, and they have these conversations next to you and not with you. And so it's a really interesting experience, a very difficult experience. My baby is very, very sick, and it took a long time for them to recover. And there's you spend a lot of time in hospital, and so you observe and you notice lots of things that go around. And I think that's what we want. We want parents to come forward and tell us, what did you notice when you were in hospital? What would you like us to do differently? If your sister came in next week, how would you like us to treat her differently than what you experienced? And so all of these stories are so important for us to hear. But we don't have families like me who are Asian coming forward. We have other families coming forward. So we want people from different communities. This radio station reaches a really far reach of different communities within Birmingham. And I know that it's broadcast wider than Birmingham, but we're looking mainly at West Midland families. If West Midland families from different backgrounds can come forward and tell us about your experience. I mean, sometimes people have had experiences of kind of that have ended up with their baby dying, and that's really awful, and we don't like to talk about that, but we'd like to know what it was like when that happened to you. What was it like with your baby? Did we get it right? What kind of things can we do to make it better? So all of those things that are really hard to say, we want to hear, and we want to hear from families who English isn't necessarily their first language. So if you think, oh well, I don't speak English that well, I don't have anything to contribute, we want to hear from you. So if your first language is Somali, or it's Bangla, or it's Sylheti, or it's something else, come forward and tell us, because they hear from people like me all the time, because you can imagine Davey and Claire are fed up of hearing my voice most of the time, but they want to hear from people who we don't hear that often. So that's my little bit of a story for you, Kathleen.
Thank you. Gosh, that's a huge story, and actually it puts a lot into perspective when and I know in the neonatal unit you have to focus on babies, but what about those poor moms there, those poor dads there that, as you say, that are not understanding what's going on, maybe do not speak English, and we do a lot of work at trying to get these messages out to different communities. Mm-hmm. And it would be nice maybe to do some sort of voiceovers to get it out on Unity FM, maybe a bit more about how to come forward in those community languages as well after this show. Indeed, we can see if that can happen to get that message out there. How can we help those mums and dads better to come forward? Is there any ideas that you have that would encourage them to come to share their stories? Because I can see it possibly will take time. I don't know how long ago, Hannah, it was your experience, but it probably will take time for people to recover themselves, to be in a space that then they can actually come forward and share the story, for one, and then be able to help somebody else, number two. So how can we help, or how can we support those to come forward?
So we have in the network a group of parents. We call it the Parent Advisory Group. And this is a group of parents who are working with us to try and kind of do this work to improve neonatal care in the West Midlands. It's currently quite a small group, and we are keen for it to grow. We're also keen, as Hannah has said, for that group to reflect a broad diversity of families, and particularly to reflect the communities and the families who actually use the services. I guess in what you said, Kathleen, about actually it takes time, I would completely agree with you that for a lot of families on discharge from hospital, when they take their baby home, although we might expect that to be a time of great joy and relief and celebration, and it often is, it's also a time of anxiety and worry and uncertainty in itself. So there is a period of time after discharge from hospital where I guess we just need to be conscious of kind of the impact of retelling these stories sometimes. You're right, it's been a while for Hannah, and as Hannah said, we've had these conversations a lot, but even when it's a long time in the past, I think that they retelling these stories it still brings up difficult and uncomfortable feelings and emotions for people. So we kind of have a process in our parent advisory group that allows us to support parents who might struggle with that process a little bit, but also to make sure that they've had enough time after their baby's been in hospital to kind of process what's happened and be in a position to be able to retell their stories without that kind of bringing up new uncomfortable feelings.
That's really good. So they're supported along the way. And actually, that can be a really helpful process for them to work through what's happened to them. Yes, Claire, what do you think?
I think I would agree with Davy as well, but also people can give us feedback in different ways. If it's not comfortable to be part of a group, you could have individual feedback. You could do feedback by email. It could be a telephone meeting. We could come out to community groups and be part of that group. We're very open to receiving feedback in different ways. We know one way doesn't suit everybody, so we're very flexible in how we would come to receive that feedback.
Great, and I'm sure we can work on that, and maybe, Claire, we can invite you to the next event that Approachable Parenting is doing. We do a lot around baby loss, and I know today is not talking about baby loss because you have great outcomes from the unit, which is brilliant, but there may be parents there that would have had some experience and maybe want to give back to this. So it's another group of parents as well that we need to reach, and we need to be able to hear, and we need to be able to support and help them indeed as they progress with their lives.
Absolutely. And also we would really like to hear how we can support families to actually be with their babies on the unit, and really stress the importance of that time that parents can be caring for their babies while they're in hospital, and what can we do to make things comfortable and inviting and welcoming for them to be actually present on the unit and part of our team and part of that team making decisions, so they're included in everything that we do around the care of their babies. So not only that is really important to us.
Mm-hmm. Tell us a little bit about what happens on the unit at the moment. If we can just take a not so ill baby in a not such a high involved unit, kind of, what is a normal day like on that?
So a normal day would be the doctors do a medical round in the morning, a plan of care is made, the nurses implement that plan of care. We would really like the parents to be present as much as they can. They're not considered visitors, they're part of the team, and they're welcome to be present and doing as much of that baby's care as possible. We would really like parents to be part of the ward rounds whenever they can, and be so that they're really included in that decision-making process. And we would really like to support parents to do all the baby care for their babies. So that is the feeding, the bathing, the changing clothes, the holding their babies, talking, reading, singing, those kinds of things with their babies while they're on the unit.
Great, that sounds really good, and I'm sure it's really busy with doctors coming and going, and probably alarms going off and babies being fed, etc. So how do parents generally manage and cope through that situation?
They cope really well generally. We try to make beside each baby space as comfortable as possible, with a comfortable chair and somewhere for the parents to go and have a break if that environment is sometimes too much. I think staff are really conscious around the noise and the alarms and try to silence things as much as possible and really take on board that for families. So we do try to support families in their environment. We know it's difficult, and to try and make it comfortable and welcoming for them.
I think for our Muslim mums, we do understand their needs as well. So there's a lot of need for modesty, maybe, that they're slightly different to other communities. So I think, people can be open about their needs. So we will respect that if there's, if they need privacy, maybe to pump, privately, there's always space for that. So we try our best to understand what needs might be for different families, and everybody's needs are individual. But sometimes if we don't know what those needs are, it's really hard for our services to meet those needs. And that's where we find it really difficult, because often services don't know, and we can sometimes get it wrong. And then we don't know about those stories where we get it wrong. And that's part of this exercise today, talking to you, Kathleen, is about finding out what we do well, but also where we sometimes don't get it quite right for our families of diverse backgrounds. And we want to be able to improve that.
And that's a good place to stop, going into our commercial break, indeed, as we're going to come back after the commercial break and talk more about how we can help our parents and improve services for everybody, physically wise, psychologically wise, for parents and for babies. So don't tune away or tune out. Come back to us after this commercial break, parents, inshallah. And if you need to ring the studio, the number is 0121 772 8892. Assalamu alaikum. Assalamu alaikum and welcome back to Parenting Hour. You're tuned in to Unity FM 93.5 here in the West Midlands and 105.1. Our Inspire FM listeners are tuned into in Milton Keynes and Luton. So welcome back to this evening's show. We're talking about neonatal experiences, and there's vast amount of experiences indeed of babies and parents that have been through neonatal units, and services have really improved, and services are listening. And this is the message we want to get across to you this evening from our wonderful team here working in Birmingham about how to improve services, how to make services better for you, and what you can do as parents to help in that, either in telling your story to people. As Claire mentioned, it can be one-to-one over the phone, can be in your language, there's interpreters there, or there's parent groups there that can be to hear that message. Isn't that right, Claire? This is the message we're trying to get across beforehand, before the break.
Absolutely. And if parents want to be part of a bigger group and a parent advisory group that meets with other parents online, that would be wonderful as well, to share the experience in a group so that we can work on different projects together and come up with a service that is designed by professionals and parents and families, so that we really have a good service for our families across the West Midlands. And we've had that collaboration together, which is so important.
Brilliant indeed. We were talking about like a day in the life of a baby in neonatal, and you were telling us a little bit there about the environment, what it was like, and Hannah was telling us about the different culture or religious requirements that we may need for our moms, or different moms from different communities, and what's available for them. I was just wondering, when we were talking about that, and we went into break, of course, but I was wondering about, as well as that environment there, what about their midwifery needs, or their postnatal needs as mums? They're sitting there in this chair, which is not the most comfortable of chairs. There may not be even eating or drinking well because they're so worried about baby. So their milk supplies may be reducing. Who's there looking after that mother? If we just say mother first, we'll come to dads in a bit. Who's looking after that mother who's just given birth, who would normally have a team of people looking after them?
Well, I think the nurses on the unit do really take care of the mothers and are very conscious of the time they're spending with them. They would be talking to them about when they're eating, when they're drinking, how they're sleeping. But the midwives would be if the mother is discharged from hospital after having her baby, the community midwives would be in touch with that mum and be making an appointment to see her at home to look after her needs. Most units would try and contact the health visitor as well to let them know that the baby has been admitted to the neonatal unit, so they could contact the mum and make time to see her and keep in touch throughout that admission, so that there was that nice smooth transition once the baby went home.
And if the baby is still in hospital, and say baby's about a week old, still in hospital, and mum wants to be there for the whole time? Is mum allowed to stay 24 hours, or what is the ruling now? I know COVID had changed a lot of things, but what's the ruling now?
We would encourage parents to be present as much as they want to and feel able to and feel comfortable to. Obviously, we need to consider how much parents rest and sleep, but units are really trying to facilitate parents being present 24 hours if they want to be, with comfortable chairs at the cot side. It's not always possible, but we're working really hard to try and make those facilities available for families. So that is part of the work we're doing and why we need to hear from families, because we want to know what is it that you need to help you be present with your baby as much as you want to be. What facilities do we need to have, and what do we need to make you comfortable?
And would parents and mums get their meals there, for example? You know, if they were there beside the baby, would they get their meals, or would they need to bring in their own food?
Some units would provide discounted meals. Some units provide nothing, and most parents would want to bring their own food in and have it on the unit, that have facilities to heat things up and a comfortable space to go and eat that food. But it does vary across the Midlands what is available for families as far as food goes. Tea and coffee is provided on most units, but it's variable on meals.
Okay, so we're looking there. Thank you for Claire for going through the physical side of things. Let us look now at the psychological side of things for those mums. What's happening for them there? What kind of care and support is there for them?
I was just going to, if it's okay, Kathleen, just add something to what Claire's just said about parents being able to be with their baby 24 hours a day. We do absolutely as much as possible to facilitate that, but I think it's also really important to acknowledge that for some families that can be really hard. When there are other family members at home who need them too, other children, or even if there's not, then actually psychologically, spending 24 hours a day in a hospital can be an absolutely overwhelming and exhausting experience. And some families want to be at the cot side with their baby because that feels like the right place for them to be. Some feel like they need to be there because being away from the cot side is really anxiety provoking. And yeah, I guess really we just try to kind of work with every family to make sure that they find a way of being with their baby that's sustainable for them. Because if a baby is in hospital for more than a week, some babies in the intensive care units or who've been born very prematurely can be in hospital for many weeks and months sometimes. And it's really important to find a way of kind of making this sustainable for parents. And I think from a mental health point of view, that's really it's important to kind of think about this throughout a baby's time in hospital to make sure that families are looking after themselves.
Yeah. And I think, Davey, too, it's really important that families feel able to talk to staff about those things, isn't it? And plan things together so that we're all aware of what the needs of that specific family are and how we can work together and support them to be present when they can. Yeah,
I mean, in terms of the mental health side of things, the question about a kind of a normal average day on the neonatal unit is a really tricky one to answer, because there is no such thing as a normal day. Every day is really unusual in that all days kind of blend into one, but they can all be really different. And the metaphor that a lot of families use to describe their time on a neonatal unit is an emotional roller coaster. That there are days that feel full of excitement and joy and wonderful stuff, at the same time as being full of kind of worry and concern and fear and all sorts of other uncomfortable feelings as well. Sometimes those kind of happen one after the other in quick succession, and sometimes they're all there at the same time, and that it can feel like a really full head, a big bag of really, really kind of conflicting feelings for families. And Kathleen, you asked earlier about how families cope. And what I would say is, certainly what I've seen, is that they don't cope any differently to how they cope with other stuff. People bring with them into hospital their normal ways of coping, whether that's kind of turning to other people, whether it's using kind of practical ways of managing their feelings, whether it's using kind of sleep or self-care things. But people bring with them their own ways of looking after themselves. When you're in hospital, some of those self-care strategies don't work so well, particularly if you're in a neonatal unit and you're spending a lot of time with your baby. If your way of coping involves turning to relatives or turning to friends, actually being in hospital can feel quite isolating, and you can sometimes feel kind of cut off from your support network. So a lot of work that I do clinically as a psychologist in neonatal care is helping people to think about what their normal coping strategies are, and then how they can adapt them for use in this kind of new and unfamiliar environment. Sure, Henna's probably got a lot of other things to say, because I think that the experience of families on the paediatric intensive care unit is similar and different as well.
So I think it's yeah, like you said, Davey, it's a really complex environment and it changes so quickly. And I think that's the bit that is difficult for families to understand sometimes, you know, and each unit is so different. So when you move between units, which a lot of our parents do experience, so when they're in neonatal care, they might need something that's not available there. So they move to a paediatric intensive care unit for that particular bit of, medical, whether it's a surgical treatment or some other treatment, and then they might move back to the neonatal unit. So that in itself is quite hard to get, their heads around. I think the bit of psychologists, we want to hear often what people's coping is, but we can also facilitate things. So for our families who diverse backgrounds, prayer and spiritual needs might be very important to them. And we do have a fully kind of staffed chaplaincy service, which they can access as well. So, their ordinary or their things that they would do in times of distress, like pray, those things are still possible. And I think people often don't think they are. And I think that's where we sometimes fall down with not facilitating things for our families. So we want to be able to tell them that their needs can be met. There are spaces within hospitals, within both, say, Birmingham Women's Hospital and the Children's Hospital for parents and families to pray, particularly of Muslim families. Obviously, they have 5 prayers, and they will be, we will facilitate them feeling free to be able to do that. I remember very clearly one of the doctors saying to me, "Isn't it time for your morning prayer? Do you want to go now? This is a really good chance for you to go. I've got your baby." And so when she said that was so normalizing for me, but she was a Muslim doctor, so clearly she knew about my needs, but other doctors or medical staff may not know those needs. And so being able to share your stories, being able to tell us about, your needs, we can meet them. We're not very good sometimes. I think, Davey, you might tell us a little bit about some of the data and some of the research that's out there about, looking after particularly South Asian families.
Yeah, so there was a report that was published by Bliss. The Bliss are a charity, the charity for premature and sick babies, and they published a report earlier this year around South Asian families' experiences of neonatal care. And it doesn't come as a surprise. It's saddening, but it doesn't come as a surprise that there are challenges, particularly for families of South Asian origin. It's important to kind of note that most people who participated in that report felt that their baby received good care and they trusted that staff would make the right care decisions. But there were kind of variable experiences. So some people experienced really excellent care, others felt like they had more of a poor experience. And two of the things that kind of felt particularly challenging for me, the first was that parents who didn't speak English as their first language were more likely to report poor care experiences. And the second was the conclusion that kind of cultural assumptions might make it harder for dads to participate in care. And I think I'm not sure that that's necessarily unique to the South Asian community. I think that's probably true of lots of different groups as well, that actually fathers and dads sometimes because of kind of cultural understandings about the role of dads and fathers and partners generally in the care of a baby, it's harder for them to know kind of what their role is on a neonatal unit. Sometimes they feel that actually their role is not on the unit, it's at home or at work. But dads are as much a kind of part of the baby's life and the baby's care as any other member of the team, whether it's mom or the family members or the clinical team. Certainly when I think about the psychological support that I offer, so I, in addition to working in the network, I work as a psychologist at the Women's Hospital on the neonatal unit in Birmingham. And a lot, like a significant proportion of the people who are referred to me for psychological support are mothers. A very, very small. I think last year about 6% of the referrals that I got were for fathers or partners. Most of the dads that I saw because they came along with their partner to support their partner rather than accessing that support themselves. And I think increasingly over the kind of coming months and years, we are going to see an increase in the availability of psychological support in neonatal units. At the moment in the West Midlands, there are a small number of units who've got psychological support available there, embedded on the unit, which is fabulous. And the NHS England have just invested some funds in increasing the amount of psychological support that's available in neonatal units, which is fabulous. But I guess certainly from what I've seen in the service that I deliver, I'm not sure how accessible that support is to dads and to people from minoritized groups. So people particularly from kind of Asian and Black populations as well, I think are less likely to access that support in neonatal care, which is, yeah, I guess one of the reasons why we want people to join with our advisory group is to think about how we can deliver these support services in a way that feels accessible to everybody.
It is really difficult, David, and you brought up a topic there that's very close to my heart indeed, about educating not just mums but dads. At the moment, Approachable Parenting is delivering programs, Pregnancy and Beyond, in Urdu, Bengali and Arabic, in different languages. And although they are now being piloted out to mums at the moment, well, we encourage dads to come, but our ambition is in the next few months, so watch this space, is dads only courses to educate dads by male trainers, because we know it's worked in other other fields with the with children when they're older. So we're trying to get dads more involved and to be there to be able to support and be involved and get that support that they need themselves as well, and be educated themselves, because there's a lot that we need to do. You talked about education and helping people. We talked about the physical support. We've talked about the emotional support. We talked about the spiritual support. It all comes together indeed in helping our families, especially through a time like this, where it is often unexpected and very difficult for the families to be able to cope with, don't know where to seek help, where to go to for help, what to do. Henna, from your experience, what would you give, what tip of advice would you give our families, our Muslim families?
I mean, it's really difficult because I think, Kathleen, you and I talked off air about how families might feel by speaking up. Sometimes our families are really worried if they do say something, if they say, will they be treated differently? Will they be known as, oh, that's the difficult mom, especially when you're maybe overtly looking like, a practicing Muslim family. Maybe your husband has a beard, maybe you wear a headscarf or you wear niqab. Will you be looked at differently if you raise your voice and you ask for things? Those things sometimes come into our heads as Muslim women. I think we've got to acknowledge that sometimes we have our own anxieties and some of our own experiences of racial trauma, or being of racism outside of the hospital care. So, sometimes you have had that experience of someone being racist, some slur being thrown at you. And you worry then, if you raise your voice, if I say something about my child or my baby or about myself, will I be treated differently? And we have to be really honest. Sometimes we don't have the best experiences in the hospitals in Birmingham. But I'd say to women to come forward, to dads to come forward and talk to us, talk to your healthcare team. You know, myself, Davey and Claire are all part of this team, and we're here to be able to hear your voice. So it is a big step. It's hard. Sometimes, you know, your experiences do then influence how you might interact and behave. Sometimes we come into hospital already with our armour on, expecting to be finding it difficult. So we've got this kind of wall around us already. Sometimes we come in and we're like, okay, well, someone's going to look after my baby, so I'm going to leave my baby in the care of these lovely people that are here, and I'm going to go off and look after my other children. And sometimes then people don't understand where you are. So we get this in hospital: we haven't seen that parent today, where have they been? So let us know that you've got 5 children at home that you're looking after. We don't know that, and you know, and maybe we need to get better at asking you as well. So I think it's the thing that's two-way, isn't it? We need to, and we're trying, and by asking families is a good way of us improving our care. So I think it's those things that I would say is my final message to the listeners out there, to the families out there. We do ask a lot of you. We want to wait till it's okay for you to talk. So don't come, you know, if you've just had your baby now, we don't want to hear from you right now. Take some time with your baby and rest and recover from the experiences that you've had. But in time, think of us and come back to us with your stories.
And I would second that, Hina, because I have spent a lot of time with families, and I do try and talk with families and get to know them and understand them and come up with a solution and a plan together so that we understand your family dynamics and the time that you can be with your baby and time that you need to spend at home with your family. So it's really important to have that nice open communication with each other.
Seems to be a clear message coming across here, this open communication of how we both, all of us, need to be communicating better, listening better, picking up points better. So it's not just from you this morning coming to us as a community, but also our community, our families need to be communicating better and getting their points across. What are their needs, what's going on for them, and how we can help and support them. And I know we focused a lot about mums, and David, you talked a little bit about dads there, and I just want to talk another couple of minutes about dads, because I feel dads are often pushed aside, and maybe in our community as well. They're often kind of, you know, not the ones involved in everything. It's not just, and it's normal, I suppose, in ways, because they haven't given birth, and the changes are not happening to them in their body, and they're not able to breastfeed. So there's a lot of things that keeps them differently. But dad's role is key. Dad's role is so important. Dad's role really needs to be there. Dad can pick up on so many things, actually, things that are happening to mom, things that maybe the connection or the interaction or the attachment or the bonding that's happening between mom and baby, how that's developing. Dads can pick up on all of this. What kind of messages can we get out to dads?
Yeah, I completely agree. I feel really strongly about this. I think you're right that the needs of dads are different, but I think my key message is that doesn't make them any less important. It just makes them different. So if you look at the research, the kind of trajectory of mental health problems for dads is different to mums. So mums who go through neonatal care, or mums whose babies in neonatal care, are increased risk of things like post-traumatic stress disorder. But that tends to happen within the first kind of 6 months after discharge. For dads, that there is an increased risk, but it doesn't show up until much later. So I think it is really different, and I think that's because just the role that different parents play in the family functioning. So I mean, this may change, right? Because there's recently been things happening in Parliament to grant parents of premature and sick babies additional parenting leave. So that will hopefully change, but you know, a lot of dads, particularly dads who are self-employed, really struggle to practically and logistically manage with kind of how to be around, how to help, because they have a job, they don't have very much in the way of paternity leave at the moment. They may not necessarily have an employer who is really supportive of them taking time off work. If they're self-employed, maybe they just can't afford to do that. And particularly at the moment, with the cost of living kind of being increasingly a big problem for everybody. These kind of things are a real challenge for dads to kind of think about how I can be most helpful and present with the rest of my family.
Brilliant. And it's really
sorry, I was just going to say that, you know, some dads feel really guilty about that they have to do that, and they really just don't feel like they have any other choice. And I would just say that actually, if that's the only choice that you have available to you, that is as much a part of looking after your baby as changing nappies and doing all those other things. If that's how it has to be, even if you don't want it to be that way, actually, that, you know, a family functions by having lots of different people doing different roles, and it just has to fit for each individual, I think.
Brilliant. Thank you, Davy. And we're going to give the last minute to Claire to emphasise what it is you want our parents to go away with from today's show.
I would really love for some families and parents to come forward to share their experience with us, to really help us try and improve the services that we deliver across the West Midlands.
Wonderful, to improve. And how can they come forward? Is there an email?
There is an email. It's very long, and I know you've said that will be available through your station, but it's bwc.westmidlandsneonatalcarecoordinators @nhs.net.
It is long, but our studio managers are there, so please ring 0121 772 8892 and they will pass that email to you. And these messages, please pass on to your friends, to your family, to your uncles, aunts, neighbours, to get involved, to help to make those positive changes that we're talking about today. Thank you so much. Thank you, Hannah. Thank you, David. Thank you, Claire, for coming on today's show and getting those messages across. And to all our families and all our families that have babies that are ill at the moment in different units, we hope, inshallah, that they will all get better and that they will all improve, and that you will look after yourself and your baby and come home to your families, inshallah, very soon. Please tune in to us again next week for another show. And until then, do ring in and follow up this, inshallah. Assalamu alaikum.